Good evening and hello everyone. It's now 7:01, so I think we'll begin because we've got a packed agenda. Welcome to the third annual DEA AMA webinar. Tonight's webinar is Driving Action on Climate Change. First and foremost, I'd like to acknowledge the traditional owners of the lands that we may be on. For me, it's the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past, present and emerging. Also take a moment to acknowledge their true stewardship of land, of country for millennia, and how important it is to collaborate with First Nation people, both in Australia and globally. Because unfortunately, unlike First Nation societies, many modern societies have forgotten or inconveniently chosen to forget or acknowledge society's health's inextricable link to environments that are healthy, productive, and stable. Humanity is now in trouble. The last decade for climate action has been squandered, and we need to act now. As the UN Secretary General just highlighted last week, Antonio Guterres, leaders must turn up the heat now for climate solutions. We can still avoid the worst of climate chaos, but we don't have a moment to lose. And so it is with great pleasure that I welcome you all to the third annual webinar, where we hear from Australian medical leaders and experts about what has been done and what must be done to lead the necessary transformation changes to get our own house in order. Because healthcare cannot or should not cost the earth. And recognising this, the AMA and DEA have worked together now for several years to address healthcare's climate footprint and also to build climate action amongst our professional groups. And with that, it's my delight to introduce Professor Steve Robson, the Federal AMA President, who is going to say a few words and then introduce our speakers for the evening. Thank you, Steve.
Yeah, thank you so much, Eugenie. I'm the Federal President of the AMA, and I want to acknowledge the traditional custodians of the land which I'm presently on, the Ngunnawal and Ngambri people, and extend the acknowledgement to wherever you may be dialing in from this evening for the webinar. Pay my respect to elders past, present and emerging all around the country. And I want to acknowledge and welcome any First Nations colleagues who are joining tonight's event. Welcome. I've been extremely concerned about climate change for many years now. It really developed as a passion for me during the bushfire season of 2019-2020, when it became clear that the effects of climate change were not theoretical in any way, but were affecting all of us. And since then, our experiences all, both locally and globally, confirm just what a challenge this faces and what health effects this potentially has and will worsen. I spent some time last year in Lismore after the catastrophic floods that affected the region and just saw it firsthand what we're likely to experience with increasing ferocity and increasing frequency in years to come. It's really critical that we understand that environmental sustainability is critical to the sustainability of our health system, and that we need to act decisively to prevent climate-related disasters and to reduce greenhouse gas emissions ASAP. Some of you may know the AMA and the DEA declared climate change a health emergency back in 2019, and we've committed to a net zero healthcare sector by 2040 with that interim goal of an 80% cut of emissions by the end of this decade. It's not going to be easy. As Eugenie said, it's our third annual AMA DEA webinar on climate change and sustainability, and there have been some positives. When we executed the MOU this year, we recognised that our previous MOU actually achieved the objectives of establishing a National Health Sustainability and Climate Unit, and the Department of Health and Aged Care recently closed their consultation on developing a National Health and Climate Strategy. And it's an important achievement, but just one of many that's needed. But many of you have advocated very tirelessly for this. They're first steps, but the work isn't over, and we need to keep building that momentum and make sure that the unit and the strategy are resourced, effective, and accurately reflect the urgency that we have to bring to protecting Australians from the health impacts of climate change. And we need to make sure that as our healthcare system is already just so stretched, that we have the capacity, the leadership, and the support to create a more sustainable healthcare system. Unfortunately, Australia is behind a number of other countries in acknowledging and acting on the health impacts of climate change. So it's important that we as a group raise awareness that funding and climate change action are not something fanciful, but they are a critical investment in the future and not a cost. So the AMA and the DEA have asked the medical colleges presenting here tonight to sign on to a communique, and I'm delighted to announce that a number of them have. The signatories to that communique support a net zero healthcare system by 2040, adequate capacity and capability of the National Health Sustainability and Climate Unit to enable delivery of an effective national health and climate strategy, the incorporation of climate health impacts and sustainable healthcare principles into the education curriculum for all levels of the medical professionals, right through from medical student to specialist. It also advocates for the clinician's role to protect patients against the health impacts of climate change, and meaningful consultation and collaboration with First Nations Australians to develop a climate resilient, sustainable healthcare system and climate mitigation strategies. And a health for all policies approach to maximise the synergy between good climate policy, health policy, and the wider determinants of health. So a number of medical colleges will be speaking tonight, and many have signed on to support the communique. It now gives me enormous pleasure to introduce my colleague, Professor Paul Kelly, Australia's Chief Medical Officer at the Department of Health and Aged Care. And Paul's going to be speaking about the government's important work on climate change and health and sustainability in healthcare. So over to you, Professor Kelly.
Thanks, Steve. And I'm joining Steve on Ngunnawal and Aboriginal country here in Canberra tonight. And I pay my respects to the elders past and present and the emerging leaders on these lands, but also to any Aboriginal or Torres Strait Islanders that might be joining us tonight. I'd echo the opening remarks about the importance of including and acknowledging the leadership of First Nations people who have guided us and continue to guide us if we listen in understanding the intimate connections between the human existence, the environment, land, culture, and the rest of nature. And I think those things are really important. I'd like to acknowledge the role of many of you, but also particularly the AMA in galvanising action, and DEA, of course, throughout many years, and really acknowledge that the value of the work that you do and the continued advocacy in this really important issue. I'm very pleased to be asked to say a few words tonight. As Steve has mentioned, I've been very passionate about climate change for many, many years. In fact, over 20 years, I introduced a course in the Masters of Public Health up in Darwin, where I was working at Menzies School of Health Research on the effect of climate change and globalisation on human health. So it's taken a while to get back to that, but to be in the position I am as Chief Medical Officer and have that influence is an enormous privilege, and I'm certainly not going to waste that opportunity. I think as doctors, we're acutely aware of the physical effects and impacts that increased heat and other climate-related events are already causing causing issues within Australia and most other parts of the world. But I think there are wider effects that we're now starting to understand and need to consider in a health and all policies approach. The effect of heat events on domestic violence, for example, the incidence or the increasing incidence of climate-related emergencies on mental health, and particularly climate concern on young people's mental health and the rise of anxiety in relation to that. All of these things are important. So responding to those challenges requires a strategic approach to ensure that we allocate our resources in the most effective way to meet the challenge. It also requires that we have structures in place, such as the new Australian Centre for Disease Control, to implement the strategy going forward. So thank you to the team who've got the slides. So this is the slide I'll talk to now. I want to spend some time speaking about the National Health and Climate Strategy. That's what I was asked to talk about, and many of you have been part of the stakeholder engagement and input into the thinking around that. And so I'll spend most of my talk around the emerging strategy. It's currently being developed within my group in the Department of Health and Aged Care, the CMO group in that department. We anticipate that it will be published by the end of the year. So that's certainly the time frame. And in fact, meeting with Minister Carney, who's the lead on this later this week, to work through the final stages of that strategy. The work on the strategy is being led by the National Health, Sustainability and Climate Unit, which was established last year, was an election commitment, and as mentioned by Steve, it's been advocated for some time. And it's there to address the health risks of climate change. It coordinates climate change responses across the health system, but it is also very much linked with many other initiatives in the Australian government in terms of climate policy more broadly and emissions reduction in particular. The existence of the unit and the fact that the National Health and Climate Strategy is being developed is in many ways a testament to years of tireless advocacy, and I really thank you all for that. The strategy is a key initiative of the Albanese government's strong commitment to confronting the urgent threat of climate change and the climate crisis that's been mentioned. That commitment is being driven across the whole of the government with many other partners in other agencies. And indeed in collaboration with partners in Australia and states and territories as well as around the world. The government is working across the board to maximise the opportunities of the clean energy transformation for Australia and our region, and to invest in strengthening communities' resilience to climate risks such as heat waves, fires and floods. Our team in the unit is working closely with colleagues in these other departments for these broader government initiatives. And so the climate and health strategy is only a part of that larger piece of work. Next slide, please. So since the development of since we started the development of the strategy, and it was announced in last year's budget, there's been an enormous amount of work that's been undertaken across the country. We think many of you, probably all of you on this webinar, have contributed in various ways, either coming to one of our 12 face-to-face workshops, 4 virtual workshops, the 300 people that participated in those workshops, and the various submissions that have been received from individuals, but also many organisations. And we really thank you for that. It's been an extraordinary co-design of this particular strategy. Next slide, thanks. So tonight I plan to foreshadow the work, what all of that consultation and the thinking that's gone into this, where it's headed, and with a particular focus on the implications that will have for clinicians such as yourselves. It's important to note that the strategy is still very much in the development phase, which means that what I discuss here tonight is preliminary and subject to change. We have not finalised this with Minister Carney or others, and so please take this as a draft for discussion and for further information rather than the final version. So in the strategy, they fall under 2 key overarching objectives, and these are familiar to all of you, I'm sure. Firstly, is mitigation, about reducing the carbon emissions from the health system itself and highlighting the health benefits of emission reductions more broadly. The second is about adaptation and responding to the health impacts of climate change, which are already here, and regardless of where we get to with our emission reduction, will get worse. Given the focus of tonight's webinar, I will focus predominantly on our work on reducing health system emissions, but it's important to hold in your mind that our work goes well beyond that and extends beyond the boundaries of the health system as well, and into those adaptation components. We will also be looking to lay the foundations for reforms that will support the long-term sustainability and resilience of the health system and communities, and that's somewhat outside of the actual strategy itself, but an important component going forward. So on mitigation, the first thing to note is that we would anticipate our efforts in mitigation will cover all aspects of greenhouse gas emissions, from on-site energy use to our international supply chain. So all of those scopes are within scope. Next slide, thanks. I want to firstly touch upon prevention and primary care, and there'll be other speakers later who will go into detail from that perspective. But I think a first step in improving people's health in Australia and tackling climate change is preventing ill health in the first place. And so prevention, primordial prevention, primary prevention, all types of prevention improves population health, and it has an effect on the climate. It reduces greenhouse gas emissions by reducing the need for healthcare, and it also reduces population vulnerabilities to health impacts of climate change. The Department of Health and Aged Care will continue to deliver the priorities outlined in the National Preventive Health Strategy, which is already written and is already adopted by government, recognising the influence of the wider determinants, including environmental and commercial determinants on people's health and well-being. Aligned with the National Preventive Health Strategy, I anticipate that this climate strategy will support the development of a national active travel strategy. Active travel can improve individuals' communities' health and well-being, increase social connectedness and access to services, but also has, of course, a climate effect with reducing transport greenhouse gas emissions and improving local air quality. So it's a win-win-win. Next slide, thanks. Before we begin to think about acting on point sources of greenhouse gas emissions in our health system, we must ensure that the care that we are delivering is of high quality and appropriate. Healthcare is appropriate when it responds to clinical need and is based on the best available evidence. It means offering patients evidence-based interventions that optimise benefits and minimise harms. The Australian Commission on Safety and Quality in Healthcare is building on its Australian Atlas of Healthcare variation to develop guidance on embedding a focus on appropriate care in corporate and clinical governance. Many of the colleges I know, and some will speak about this later, are already taking action in this space. For example, the RACGP published First Do No Harm, a guide to choosing widely in general practice. Every time we do unnecessary or ineffective healthcare, we are increasing emissions in the health system. Let's all work together to stop that. Next slide, please. Some very specific items now, because I think it's important for us to build on the work that's already been done by various specific colleges or particular hospitals or particular jurisdictions within Australia. Let's broaden that out to be an Australia-wide action. So desflurane, for example, has a global warming effect several orders of magnitude higher than carbon dioxide or indeed many of the other anaesthetic gases. In August this year, WA have led the way by removing desflurane from its statewide formulary, and many other health services across the country no longer use this gas. We anticipate that this strategy will include working with others to sustainably reduce, if not eliminate, the use of desflurane in Australia. We understand a high proportion of nitrous oxide is wasted due to leakage from piping systems, resulting in gas going straight into the atmosphere. Very, very convenient, but it's a waste and one that leads to greenhouse gas emissions. So let's deal with that. Use of pressurized metered dose inhalers, particularly relievers for asthma, can be reduced by ensuring that respiratory patients are on preventers and switch from metered dose inhalers to dry powder inhalers where that's clinically appropriate. Large use right across the country. Let's think about how we can change that together. Next slide, please. So procurement and waste. The supply chain, including medicines, medical equipment and all other products, contributes to the largest proportion of health system emissions. Actions to reduce supply chain emissions need to come from both the consumer side, so reducing, reusing, refurbishing, recycling, and from the producer side, reducing packaging and changing manufacturing processes to reduce emissions embodied in consumables. We anticipate that the strategy will include working with others to reduce waste and associated greenhouse gas emissions. We also need to send a signal to suppliers, as many other countries have done, that we will not be interested in doing business with them if they are not taking climate action seriously. We anticipate the strategy will commit to developing green procurement and sustainable resource use guidelines, working as closely as possible with states and territories, which consider suppliers' own emissions reduction plans and promote the principles of product stewardship and the circular economy. Addressing our supply chain emissions also requires international collaboration, and we're actively building relationships in that area right now. Next slide, please. So moving to adaptation now, I want to spend a few minutes on preventing and responding to health impacts of climate change. We know that no matter how effective we are in reducing emissions, this is going to, it's already locked in terms of climate change here in Australia. We will be affected. We are already being affected. Our health and well-being of Australians is being affected. So we need to prepare and respond to that. We also know that if we put the right measures in place, many of these health effects can be managed and in some cases prevented. There is an important equity lens here, which needs to be applied. It is particularly important that we work to ensure people who are already disadvantaged, and I would particularly call out First Nations communities, to make sure that they are not disproportionately affected by the adverse health effects of climate change. I want to talk about two areas of work that are particularly relevant for those of you here in this adaptation piece. So next slide, please. The first area is reviewing the role of primary care in preparing for responding to and recovering from extreme weather events and disasters. And Steve's already mentioned his experience in this. Throughout our consultation period, we've heard a very clear message about the key role that primary care already plays in supporting patients and communities before and after and during disasters such as floods and fires. But we've also heard that primary care and primary health networks are not well integrated into disaster planning and response. And the GPs often feel their knowledge, skills, and connections are not put to their best use during extreme weather events. In 2020, the Royal Commission on International Disaster Arrangements recommended primary care should be represented on disaster committees, and the primary care providers should be trained and empowered to better support the communities they serve in times of greatest need. We know that GPs themselves want to see these reforms and acknowledge the ROCGP's call for GPs to be at the centre of disaster arrangements in the future. There are already excellent examples of primary care and PHNs stepping in when it comes to disaster planning and preparedness. So one example is, in fact, the north coast of New South Wales, where the local PHN has developed its own disaster management framework to ensure that they have structured approaches to disaster management, such as floods. In a community that has been devastated by floods, this particular one, it is inspiring to see the local PHN stepping up and playing an active role in supporting their local communities in dealing with disasters. So we're committed at the national level to working with the primary care sector and PHNs to explore how we can capitalise on the knowledge, skills, experience and experience of primary care providers in disaster response and learn from those places of excellence, such as the area around Lismore. Next slide, please. So finally, I'd like to discuss the work that's underway in preparing the medical workforce more broadly to deliver care in an increasingly unstable climate. A number of medical schools, specialty colleges and health services have already launched initiatives to build workforce understanding and capacity in responding to the health impacts of climate change. The government, Australian government, is committed to supporting the medical profession to continue integrating climate change into training and accreditation processes, ensuring that climate literacy becomes a core competency for the medical profession. We also recognise that education alone is not sufficient, particularly given that climate change will take an increasing toll on the mental health and well-being of an already stretched medical workforce. We'll continue to work to improve doctors' well-being, even as climate change presents new challenges, because we know that a healthy and well medical workforce benefits everyone. In particular, and including through the National Disaster Mental Health and Wellbeing Framework, we're committed to supporting doctors and other frontline responders in disaster-affected communities. This is really important work. The final slide, thanks. So thank you. The medical profession already plays a vital role in raising awareness and responding to the health effects of climate change, and I thank you all for your role there. Australia's doctors are well placed to continue raising awareness and pursuing innovation and leading the transformation of the health system to make it sustainable, resilient, and fit for the needs of generations to come. I thank everyone for your collective action and advocacy to date. Look forward to continuing to work with you to build a sustainable and climate resilient health system in the years to come. There's an email address there. If you feel prompted to make comments or to give suggestions, it's not too late. Please send them to that nhsc.unit@health.gov.au. And thank you for listening.
Thank you very much, Professor Kelly. That's excellent, and it's great to hear where the unit's up to, and so looking forward to hearing about the strategy later in the year. It's a lot of people have put a lot of effort in, so it's going to be great, and it's just so good to see that that is happening. It's really a positive move from the government. So I think we have Kate Charlesworth next from New South Wales to give us an update about actions in New South Wales. So over to you, Kate.
Okay, thanks so much, John. Just checking you can see my slides okay. Yep.
Yep,
oh,
can see.
Terrific. Great. Well, thanks so much for the invitation to speak tonight. I'm Kate Charlesworth. I'm a public health physician in Sydney and the medical director of the Climate Risk and Net Zero Unit at New South Wales Health. So from me today, there are 3 key points I'd like to make. And the first one is that something that we all know, but that I don't think the wider community still does. And that is that climate change is a health issue. Okay, certainly it's an environmental issue, it's a social issue, it's an economic issue. Fundamentally, this is about health and about care. I think that we have to be relentless in that messaging. Secondly, I've been asked to speak tonight about our New South Wales Health net zero transition, and in particular, the really important role of doctors in that space. And then, whilst it is very important for us to decarbonise the health system, I think the role of doctors is actually much broader than that. Right? As Professor Kelly has alluded to, this is actually about making the health case for health in all policies and about our role in this wider societal transformation that now needs to take place. Okay, so on the first point, there is now, of course, overwhelming scientific evidence that climate change is supercharging the climate. It's making more frequent and more severe storms, floods, droughts, bushfires, and extreme heat. And from a health perspective, the climate projections are very concerning. From the Black Summer bushfire event a couple of years ago, there were more than 400 deaths, more than 4,000 hospitalisations, and nearly $2 billion in healthcare costs. And we are now on track to have Black Summer bushfire events every second year and then every year. In terms of extreme heat, ED presentations go up 15 to 20% in periods of extreme heat. And we're on track now in Sydney and Melbourne to have 50-degree days being common. Okay? So the health system is not going to be able to adapt to what is coming. It is becoming increasingly clear that if we want to live in a safe climate, we have to rapidly decarbonise. Okay? And so every sector has to decarbonise: energy, transport, agriculture. And the health system itself has a particular responsibility to do so. Because currently we're part of the problem. We use huge amounts of resources, we produce vast amounts of waste, we still use fossil fuel-based energy, have a big carbon footprint. So globally, if the health system were a country, it would be the 5th biggest polluter on the planet. Okay? And in Australia, the research suggests that our health system is about 7% of our national emissions. Okay? So we have a big task ahead of us. So how do you decarbonise a health system? You first better understand what your baseline carbon footprint is. So at New South Wales Health, our team this year has done a lot of carbon footprinting. We've footprinted 3 local health districts, 2 hospitals, 1 regional base hospital and 1 large metro tertiary hospital. That's Nepean, I'll talk about that. And then our colleagues in Health Share, that's particular focus on Scope 3 emissions, ambulance, e-health, they're also doing their own footprinting. So together, we're starting to put the jigsaw pieces together to build up a baseline carbon footprint for New South Wales Health. Okay, so this is one example. This is Nepean. It's a large metro tertiary hospital in Sydney. So the headline finding is that its footprint is 62.5 kilotons of CO2e, carbon dioxide equivalent. That's equivalent to having about 28,000 cars on the road. Okay. And then the pie chart is the breakdown of that footprint. The key parts there, of course, the red section is energy. Energy is about a third. Okay. Travel, patient, staff and visitor travel is about a quarter. And then our supply chain is about 30%. Okay. The key points here. Firstly, we have to act across all of those areas. Okay. So energy is important, LED lights are important, solar panels are important, net zero ambulances are important, but we also have to think about our scope 3 and our supply chain emissions. But I think the really critical thing, and this is the second point, is that a healthcare system is a complex system. And these sections do not act in isolation from each other. And what we're actually coming to understand that is in such a complex system, it is our whole approach to delivering care. It's the models of care and the clinical decisions that we are making that influence not just our supply chain, not just the type of drug or the procedure, but actually all those other areas as well. So for example, a clinician deciding not to do an unnecessary test or procedure has broad impacts. A clinician deciding to provide care closer to or in the home or use virtual care reduces our travel emissions. And our clinicians are the ones who can decide whether or not to safely turn off equipment, in our critical care areas and our imaging, which are big carbon hotspots in terms of energy use. Okay, so our clinicians and clinical decision-making is responsible, we think, for at least half of the footprint of the health system. Okay, so we do have to act across all of those areas, and our team works alongside other teams in energy, transport, health infrastructure, and health share. Health share do a lot of our procurement and food services and linen. And this is just one example in terms of our energy intervention. This is the new Maitland Hospital car park, which is not only, you can see that the solar panels in the car park, not only a great example of a renewable energy project, but also is providing shade in the car park, so protection against extreme heat. So it's just a really nice example of a mitigation and adaptation measure together. Okay? But our focus is on clinical care. And so when I'm speaking with our clinicians, our nurses, and particularly our doctors and allied health staff, I say, this is the most important slide for you. This is our whole approach to decarbonising clinical care. Okay? 3 principles. And the first principle is keep people healthy and well. And of course, that's because one type of carbon neutral health system would be a system in which we didn't have any patients. Okay? Everyone was healthy and well and independent in their homes and their communities. That's the first principle. And it's in recognition of the fact that so many of the things that so many of ourselves and our colleagues do every day, the health protection, health promotion type activities, tobacco control, active living, obesity, vaccination, all of those things, they're actually sustainability measures as well. Okay. The second principle is reducing low value and harmful care. We know there's a substantial amount of overdiagnosis and overtreatment across the system, and those things have harms and risks for patients and also costs, not just financial costs, but carbon costs. Okay. So that's why appropriate care is the second principle. And then the third principle is saying, okay, where we do have effective and evidence-based care, how do we decarbonise that? Okay. So that's the whole approach that we're encouraging our clinicians to adopt everything they do. And so looking at that, when we did our carbon footprinting, we were really keen to understand at a hospital level, what are the big issues for us? What are our priorities? As you can see there, it's theatres, it's ED, it's medical imaging, women's care and intensive care. So we have now net zero leads across 4 out of those 5 areas. We almost got it right. It's got 1 to go. So this is our net zero leads program. This is the first of its kind in the country. Under this program, we fund 10 of our staff, 1 day a week each, to lead on net zero projects in their service or their specialty. Okay? So the task for them really is to rethink and reimagine their service with a net zero lens. How do I provide a high quality anaesthetic service or rehabilitation service or intensive care service in a low carbon world? This is everyone's, I guess, favourite example is the example of desflurane, highly polluting anaesthetic gas, 2,500 times the global warming potential of of CO2. We are now tracking our desflurane use in New South Wales Health. As you can see, we've gone from more than 4,000 tonnes of carbon down to about 700 tonnes of carbon over the last few years. So a really nice example of our anaesthetists understanding the environmental impact of one of the gases they used, shifting away from that to clinically equivalent alternatives, saving money and saving carbon. This represents a saving of about $1 million because desflurane is very expensive. Okay. We were very pleased, also a little bit annoyed to see that WA has ruled desflurane out completely and taken off the formulary. So that's the next thing that we'll be looking at. But congrats to WA. And then staff engagement. So the focus of our unit has always been and always will be, how can we improve health and patient experience whilst reducing waste and emissions? Okay. But the surprising and the exciting things that we're starting to find there's two additional benefits. The first one is the financial savings. We've got 10 net zero projects going and a bunch of innovation projects going, and almost all of them are saving money. Okay? Some of them quite modest amounts, but some of them much more substantial amounts as well. So the financial savings is a real bonus. And the second thing is how interested and how engaged our staff are. Okay? It turns out that many health professionals are concerned about the climate. Okay? They understand that healthy people depend on a healthy planet. They are keen to be part of our net zero transition. They want to work in an organisation that is aligned with their values. And so we are now coming to understand that our 140,000 staff in New South Wales Health are going to be our biggest resource. Okay? So these are some of the things we have listed on the top left. PMS is the People Matters Employee Survey. This is the New South Wales public sector survey across the whole of government. We now have an environmental sustainability question in that. So we'll have a measure of how interested and engaged our staff are in this. We have obviously networks, position descriptions will be coming in. We're sending groups of staff on carbon accounting courses. We have sustainability as a theme across all of our redesign, well, most of our redesign and quality improvement work. And we have a new category in the health awards. And the left there at the bottom of the future direction, some of the ideas of the things that we'd like to do next. Just moving on to the third point then about our broader issue. Many of you would have seen this. This is, of course, research from Harvard University, which found that fossil fuel air pollution, okay, so that's air pollution from coal, oil and gas, is responsible for more than 8 million deaths globally every year. It's the same number of deaths as from cigarette smoking. Okay, so energy policy is health policy. Similarly, this research from Melbourne, vehicle emissions, more than 11,000 deaths a year. So transport policy is health policy. And I don't have a slide up, but we know from the research that plant-rich diet is good for people's health and good for the planet as well. So agriculture policy is health policy. So these are the sorts of messaging I think we need to be relentless with. And this is a message that I don't think we say enough. And it's a really good story, of course, and that is, as shown in the cartoon, climate action would have huge public health benefits. Right? It would mean cleaner air, healthier diets, greener and cooler cities, more connected communities, and so on. And we know in the health system itself that our net zero transition is so well aligned with a lot of the things that we're trying to do anyway. Right? Keep people healthy and well, focus on value-based healthcare, digital advances and innovation, and so on. So it turns out that a net zero transition could be our best chance ever to build an even better, a modern, a high quality health system for a low carbon world. Okay? So we have a very good story to tell, okay, about our role in this transition. And this is from Ipsos, which is a social research institute, which of course ranks every year the community perception about the trustworthiness of different professional groups. Okay? So in this net zero transition, which is our only chance to protect the health and the safety of our patients, our communities, and indeed our own families, who is best placed to lead this transition? Who has the trust of the community, can make the case for this transition and can guide us through? Is this the sort of thing that we can leave to the politicians? I'll leave you to answer that question, but it's pretty clear from this. Doctors are the most trusted and respected professional group in society. There are a lot of us We are well educated and trained. We are well organised in professional groups and in the systems in which we work. We are well respected and have a lot of influence in the media and in the community. And our voice and our messaging saying climate change is a health issue. Fossil fuels are the new tobacco. Climate action would have huge health benefits, is really important and has never been more urgent. Thank you.
Thanks very much, Kate. That is a fantastic presentation. And I was just thinking, this is, our third year that we've done this webinar, and really in that amount of time, the amount of new data and changes that have been made is really impressive. So well done to you, and well done to everyone in New South Wales working on it. And I know a few of the clinical leads are here today, so it's great to have them on board. And just as you said, that our clinical decision making really accounts for sort of 50% of our emissions. I think that having the leaders here today and everybody else interested and being able to make those clinical decisions and policy decisions is just so important. And I think we're seeing that now too with our political leaders, and you think that probably it'd be probably a good chance that 50% of their decisions probably account for all of our carbon emissions as well. And I think that they are really getting it. I think that Chris Bowen gave a presentation recently in South Korea where he said that it's actually too late to stop the climate emergency, which was astounding to hear that from such an important political leader, but really highlighted the importance that we have now of trying to mitigate against the worsening of the climate emergency. So this is where we're at now, and this is what we have to really, make a big effort to turn the ship around. So the next stage, we're going to hear from all the colleges about what their actions have been and what we're planning. So this is always pretty action-packed part of the evening. I think, in fact, this year we've got a little bit longer for everyone's presentation, so hopefully they won't have to squeeze as many words into every minute as we've had in the past. We're going to start with the Australasian College of Dermatologists and Dr. Kendall Sharp. I think you're up first.
I am. I do apologise to everyone. For some reason, I am communicating via my phone. Every time I try and start my video, it doesn't work. But can you hear me okay?
Yep, we can hear you.
Yeah, perfect. Okay. So we're just a small group within the Australasian College of Dermatologists. There's about 6 of us that meet fairly regularly, once every 6 weeks, to discuss climate action strategies that we can undertake within the college. And for a small group, I think we've done reasonably well over the last year. So if we could flick to the next slide, or even the one after that, that would be awesome. So first thing that we did was we published a summary article in the MJA in May of this year, which was basically summarising the effects of climate issues on skin health in particular. And that ranged from everything from our inflammatory dermatoses like eczema and psoriasis, which we know get worse with particulate matter in the air and the bushfires, etc., through to the unknown impact on skin cancer at this stage. But listening to Kate's excellent talk, I do wonder a little bit as well in Australia if we're over-servicing skin cancer in a lot of industries and whether that's something we need to look at. And in particular, we looked at the disproportionate impact of some of the climate change issues and how they've affected patterns of infectious disease transmission, particularly in more rural and remote areas, which would disproportionately affect our First Nations people. So there's a great summary article, and there's a nice little summary table if anybody's interested, which I've screen grabbed to the side of that slide. And one of the strategies that we highlighted that would be part of what Dr. Kelly and also, pardon me, sorry, and also Kate spoke about was looking at ways that we could improve our care to regional and remote communities. And part of that was a better focus on telehealth and dermatology, because we're potentially one of the medical colleges that could have a bigger role in that space. Can I get you to move on to the next slide, please? The other part that we did in print this year, I'm so sorry. I'm going to tickle in my throat. The other thing that we did in print this year was a great article in our college newsletter, which was overseen by one of our Kiwi colleagues. So that's Dr. Eugene Tan. So he's been quite an advocate both in New Zealand and Australia within the dermatology space for improving our green ideas. And he interviewed Dr. Eugene Sachs, who is the founder of My Green Doctor in Florida, which is a non-for-profit organization. So there was a great article that we reprinted there. And I'd also draw your attention, even though it was outside of this last 12 months, Eugene wrote a great article on making the dermatological surgery more green. So if anybody wants that, I can certainly send you the link. So that's a great sort of practical guide for any doctors who are regularly doing work in a minor ops theatre. Can we move on to the next slide? Perfect. We had a presentation this year at our ACD, ASM in Sydney. That was given by Dr. Austin Anderson, who's one of the more prominent members of our environmental sustainability group. She just spoke on the climate change emergency and tried to sort of highlight that to our fairly small college in comparison to some of the other Australian medical colleges. And next year, we've actually got a whole session within our ASM, which is dedicated to environmental sustainability and some of the climate change issues, which is a huge move for our college, considering our sort of track record up until this point. Get you to move on to the next slide for me. And we also established an online presence within our college. So we've got our Sustainability Connect group now. So this is an online forum. Any member of our college is welcome to join and can discuss, interesting articles or potentially strategies that they've put into place in their own practices or within a tertiary space. So it's fairly fledgling at the moment. It's mostly us and a handful of other people, but we're hopeful that we'll get some more interest in the next few months because it's only just gone live in the last month or so. I can get you to go to the next one for me. And the last thing I would say is that we've actually made great headway engaging our own college executives in this space. So we've managed to convince them to divest from fossil fuel investments, which we thought was a huge step forward. They helped us put together the Sustainability Connect group. And like I said, they've given us a dedicated space at next year's ASM, which is great. And I think that's it from the College of Dermatologists.
Lovely. Thanks, Kendall. That's really impressive. Good work from you. Sound like you're driving that along. Good to see the online connect as well. That's a great idea. So next we have Stephen Goulet. He's from the Australasian College for Emergency Medicine. So over to you, Stephen.
Thanks very much, John. My name's Steve Goulet. I actually live and work in Mabancha or Alice Springs, right in the centre of Australia and Aranda country. And a warming climate is certainly a big concern to us because heat and water security in particular are huge issues for Central Australia. But as a college, I'm the president-elect for ASIM, so coming in and take over the reins in November. But as emergency physicians, we actually do have a bit of a role to play as leaders in advocating for climate sustainability in our hospital, our healthcare system, and across society more broadly. As the health impacts of the climate crisis worsen and become more pronounced, our emergency departments will increasingly come under more and more pressure. We're already under a lot of pressure. And what we can see is we need to prepare for more frequent and more severe climate disasters in the future, like fires and floods. In November 2019, ASIM declared a climate change as a medical emergency at its annual scientific meeting in Hobart, and we were the first medical college to do so. This declaration also coincided with the release of the college updated position statement on climate change and health. In 2021, ASIM launched its environmental strategy, which provides an overarching framework to guide the college's efforts to address and seek coordinated, meaningful action on the pressing threats to the planet and its communities across identified priorities of leadership, research, advocacy, partnerships, education, and culture. Within this strategy, ASIM is committed to actively supporting efforts to minimise the impact of climate change, including through measures to reduce the carbon footprint of hospitals and the carbon footprint of systems that we work in, and action on climate sustainability more broadly across our societies. The strategy cements the college's commitment to showing leadership in acting climate action, developing an evidence base to capture the impact of climate change on our patients, staff, and the functioning of our emergency departments, and advocacy at all levels to address the impacts of climate change on emergency medicine and the capacity of health systems which we work in. It further commits to the ongoing partnerships to ensure that health systems and communities are prepared for climate emergencies, educating and preparing clinicians for effects of climate change, and developing emergency department cultures to normalise this in society. We can't do this alone. That's why we get involved with collaborations. We've remained actively involved in the Health Climate Future, which is an initiative as part of a coalition with medical colleges coordinated by the RACP. Thank you, RACP, for putting that together. Calling for a climate-ready and climate-friendly health system via a range of evidence-based tasks. And earlier this year, ASIM also announced its partnership with the New South Wales Environmental Protection Agency, or the EPA, which was mentioned just earlier in the talks, which will seek to better understand the impact of environmental sustainability measures and climate change events on the state's emergency departments. The project will survey New South Wales emergency departments to quantify and qualify the medical waste generation and the excessive sustainability measures across the state. It will also seek to quantify the effects of climate change events on workload costs and resources within the ED. We fully support the principles of the Choosing Wisely campaign and are actively seeking measures to reduce our use of unnecessary tests and procedures. And we are also about to establish a climate change network, which is going to continue to improve our work in this area. We're really fortunate in ASIM to have a lot of very passionate people, particularly in climate change science. And in fact, some of ours members have gone on to do climate change fellowships overseas and brought that knowledge back to us. One of the things I really like about emergency physicians is you tend to be quite socialistic in your approach, and we tend to have a high number of what I call the social justice warriors. And it's great to see them taking up the claim, because certainly climate change is our #1 existential threat to human life on the planet. And we support that. So thank you very much, John. I hand it back to you.
Thanks very much, Stephen. I know a number of emergency physicians personally, and I know that they are very engaged on this issue. So hopefully, and you're definitely kind of at the front line of it. So it's great to have everyone on board. And yeah, good luck taking on the presidency, is it? Yes.
Yeah, thank you very much, John.
So next is from the Australian College of Rural and Remote Medicine, is Dan Halliday. Take it away, Dan.
G'day, John. Thanks very much, and thanks for having us here tonight. So to next slide, thanks. So I'm coming to you tonight from Camberwell Country, so Stanthorpe in southeast Queensland, up on the range. And I'd just like to reference ACRIM acknowledging Australian Aboriginal people, Torres Strait Islander people as first inhabitants of the nation. And we respect the traditional owners of lands across Australia, which our members and staff work and live, and pay respects to elders past, present and future. Next slide, please. So ACRIM obviously has updated its position statement and policy and advocacy on climate and health, and certainly we recognise the fact that the effects of inherent climate variability, but actually the escalated effects on climate change, on that that climate variability is actually quite significant. The worsening of droughts, the worsening of fires, the worsening of floods, and it's actually those resource poor and remote and rural and First Nations communities that actually often suffer the most in those events. The sustained, immediate and sustained action is required, recognising the fact that there is a significant social justice imperative to address climate change and health, in this area, is that there's actually also a need to support our remote, rural, and First Nations communities to actually undertake those initiatives that we believe are important, and certainly there needs to be a rural lens and rural and remote proofing lens on this. To ensure that our communities that are more disadvantaged can actually contribute, to the wider climate change, initiatives and developments. Certainly, we have obviously committed to the development of a national climate change, climate and health strategy. And one of the key things that we believe that the college can actually do in that, is that as a business as usual approach is to actually promote and embed the role of rural generalist medicine, and obviously under the specialist practice of general practice in public health, primary care, mental health and community responses. So this is quite significant in terms of the way that we actually have a continuum of care from the community right through, into general practice and hospital, based care. So that's secondary based care and even levels of tertiary based care, in pockets of our rural, remote and First Nations communities. We know that care close to home reduces the travel and transport costs associated, with the provision of care, and certainly that's a significant component of, ensuring that care is provided close to home in our rural, remote and First Nations communities, and actually embedding that in the way that we actually deliver our curriculum, and encourage that practice. Obviously, internally, the college itself actually commits to using IT, and remote connectivity wherever possible. The opportunities associated with, looking at working with our communities, and the extension of that to look at community-based solutions where possible. Obviously, educating, advocating, and working, for and with our communities is actually part of that, and developing a stronger engagement with our consumer reference group, to actually look at how we partner with communities in the health space, in our remote, rural, and First Nations communities is a key part of that. The opportunities to support our members in environmentally sustainable practices is part of that process as well, and being leaders in that space. Myself in Stanthorpe, with our local team, we've partnered with Queensland University of Technology to actually do a waste audit within our local hospital, and to actually look at assisting, in that audit and evaluation, and to, envisaging how rural hospitals could actually look at their waste audits and actually reducing, the carbon footprint, associated with the practice in those areas as well. So I think it's very key that we actually do take a stance and actually lead the way where we can, even in a small local footprint, to make sure that we actually can think and act globally as well. So next slide, please. So in terms of our doctors driving action, so we do. Sorry?
Just 15 seconds or so to go, mate.
Lovely. So we have a very vibrant community of doctors, in our rural areas, and certainly the extension of primary care, into that. We believe that our members are community leaders and advocates. We'll be working with our communities going forward to ensure that we plan and contribute to public health initiatives, and obviously the key part, as referred to earlier, to ensure that the role of rural generalist medicine and general practitioners, serving their communities in natural disaster and emergency events, is one of the key drivers going forward as well.
Great. Thanks very much. That's really terrific, and obviously, the rural medicine is so important, and we see all these major climate events tend to be occurring in the rural areas, so it's so important. So next we have Archie Shrivastava from the Australian and New Zealand College of Anaesthetists. So go for it, Archie.
Thanks very much, John, and thanks to all of the other speakers as well. It's fantastic to see what the colleges are doing to progress our efforts in this area. So I'm involved in the ANZCA Environmental Sustainability Network. I have been for a couple of years now. ANZCA's response to climate change has kind of been progressing since for a few years actually, and other people in this webinar, including people like Eugenie, have been very heavily involved from the beginning. Next slide, please. Thank you. So beginning with the Council statement on climate change and the formation of the Environmental Sustainability Working Group, which occurred some years ago now in 2018, there's been some progress within the college with regards to developing college guidelines and guidance for fellows of the college and other anaesthesia practitioners in ensuring that our practice is more sustainable. Kate mentioned earlier in her breakdown of emissions throughout a hospital that theatres emit the greatest amount or contribute the greatest amount of CO2 emissions, and therefore we do have a significant responsibility to play in reducing emissions. And of course there is the broader concept of global health, planetary health and climate change, to which we're contributing both from a healthcare perspective but also specifically from an anaesthesia related emissions perspective. Within the college, we've made quite a lot of progress actually in the last couple of years with regards to both educating and advocating for change in anaesthesia practice and in the delivery of healthcare throughout. This included the release of an environmental sustainability audit tool for fellows to use within their own clinical areas, but also changes within the college. As we mentioned, we can't progress this work without cleaning our own house first. As such, we've developed a library guide and the sustainability network. Next slide, please. Thank you. So within the college itself, in ANZCA's operations, you'll see some concepts here which are translated across from the Green College guidelines as well. These were this aspect of greening ANZCA's operations was put into place a couple of years ago now, breaking down internal emissions and where they can be reduced, including corporate governance, travel for fellows and for meetings and such, and the conferences and events. And a more recent audit against the Green College guidelines has actually indicated we're doing reasonably well in meeting those targets, with some areas that we're still working on. Next slide, please. So from there, we've translated concepts into the Environmental Sustainability Network as well, which is a network which ANZCA fellows, trainees, and any other health professional involved in the delivery of perioperative care, or really any other health professional, is very welcome to join. It's open to any member, really, or anyone who is interested in being involved in this area of practice. In promoting sustainable practice, we've broken down our targets within the network into advocacy, education, and research. So advocacy being, for example, the development of professional documents, and advocacy outside the organisation, for example, involvement with colleges, other colleges and organisations such as the DEA. Education in developing materials for fellows and trainees, and in promoting research and in developing research grants as well. Next slide, please. So within our activities in the last year, this is just a few of them. I can't kind of list all of them here because I definitely run over time, because our members have been prolific in how much work they've managed to achieve. We've had representation in the Sustainability Network across all Australian states and territories, and we are a binational college, and as such we have New Zealand representation as well, and from the Faculty of Pain Medicine, which is of course a part of the college. We've had special interest groups formed within these, so we've talked quite extensively already on issues such as desflurane and nitrous oxide and their emissions. And for us as anaesthetists, these are low-hanging fruit that we can address. And I'm proud to be from WA, where we've managed to get the state formulary to remove desflurane, and hopefully that will be reflected in other areas across the states as well. We've also been invited to consult on the National Climate and Health Strategy and be involved in the development of the desflurane and nitrous oxide targets going forward. Our ANZCA Council is imminently going to endorse the Green College guidelines as well as emission reduction targets. Next slide, please. Other activities that we have managed to achieve in our most recent ASM in 2023. This was...
Archie.
Thank you. In 2023, we had a concurrent session showcasing a number of speakers and having a panel discussion. We've endorsed the ACOA guidelines with regards to neuroanesthetic and the environment for consumers, and we regularly have articles for fellows and trainees within the college to access, as well as a constantly updated library guide. So I'm really proud to say that members of the Environmental Sustainability Network have managed to both create impetus for change within the college, but also linked in with a number of organisations outside. And we hope to keep going forward. Thank you.
Well done. What a great amount of work. You guys just doing sustainability. I don't know if it's time to do the other things, but very well done. Well done. So next we have Nicole Higgins from the Royal Australian College of General Practitioners.
Thank you all. And I think listening to everybody, it made me realise how much work we actually do together as colleges, and also through the vehicle of CPMC, which is the Council Presidents of Medical Colleges. And I think there's a lot that we can actually offer through working and collaborating together. So being a GP in North Queensland, so a place that is subject to, many natural disasters and the impact of climate change, GPs really, we often say that we're the cost-efficient foundations of the healthcare system, but we are also the carbon-efficient and area of the healthcare system. And going back to what Professor Kelly said earlier, trying to keep people out of expensive hospitals, looking at preventative care, we need to make sure that we invest in the foundations and prevent people from entering the hospital systems and more expensive and carbon intensive places of the healthcare system. As said before, when we start looking at about cleaning up our own backyard, it makes us reflect on what we're doing internally as a college, what we're doing for the profession, and what we're doing for our community. So within RACGP, like others, in 2019, we launched our position statement on the impact of climate change. In 2022, we employed a sustainability officer as well. And at this point, I want to shout out Kate. Thank you so much for all the work that you do, because we have a specific interest group of climate and environmental medicine. And we have 1,400 members, which, is really significant. And what this group has done has contributed to the curriculum for GP training and ensuring that climate is part of how we train our future GPs. We as individual members and also representing RACGP contribute to many of the climate change campaigns, and I'm thinking around Middle Arm, also the push to ban gas in new homes in Victoria. The one thing about GPs, we are integrated very much into our community and very hands-on, and we have the ability to mobilise our communities, our patients, and be able to educate. And the strength of being able to do that is very powerful, especially around the issues of climate change, whether it be around the devices that we use, the resources that we use as well. So where we sit now as a college and going forward, at the end of this next month, at the end of October, we have Wonka. So Wonka is like I'm going to say it's like the FIFA of general practice. This is the place where all the GPs from around the world gather. I think we've got over 3,000 GPs descending and family doctors descending on Sydney. And we have got one of the huge focuses for us, especially as we live in the Pacific region, is having those discussions around the impact of climate change on the healthcare systems, on how we practice as family doctors, and how this is impacting on the health of our communities. So there are many, many sessions around environmental health. Bringing it back right into a bit more of a granular level around what we're doing as, you know, an individual college versus our representational roles. When we start talking about our, environmental governance and the structures that we have got in place and how we embed that culture in what we do and how we do it, I think the good news is for organisations, similar organisations, we're actually doing incredibly well. Our total emissions are, it's really funny, I just said admissions, sorry for our hospital doctors, but our emissions are the equivalent of 76.5 passenger vehicles per annum. Now, that's pretty good. We've still got a lot of work to do, but we're really working actively to look at how we reduce our carbon footprint and also walking the talk. For me as president, looking at how, from someone in a regional area, how I can still represent and do the work I do without actually having to do the travel, and to paraphrase somebody else before, how we clean up our own backyard.
Just 15 seconds there, Nicole.
So I think the opportunity of this group is, how do we all work together amongst all the medical colleges to work collaboratively, to pool our resources, to reduce our footprint, and to send a message about what we're doing, how we're doing it, and how we can do it better. So thank you.
Thanks very much. I know the college has been involved in this space for a long time, and it's so important with so many members and so many also at the sort of coalface of interactions with people. It's very important. So thank you so much for the work your college has been doing. So Professor Lynn Madden's next, representing the Australasian College of Physicians. Thanks, Lynn.
Thanks very much, John. And hello, everyone. I'm Lynn Madden. I'm a public health physician. I'm chair of the RACP Climate Change and Health Multi-College Advisory Committee, and I'm here to share the Royal Australasian College of Physicians' work on climate and health. And I'll cover what we're doing as a college and also the work of the Climate Change and Health Multi-College Advisory Committee. Next slide, please. I'm speaking to you tonight from the lands of the Gadigal people. Thank you. The next three slides, of which this is the first, will summarise in turn the recent advocacy by the RACP, the professional development opportunities for fellows and trainees, and addressing the environmental sustainability of the RACP as an organisation. So firstly, this slide, the advocacy by the RACP is informed by position statements, of which there are 3, and they're listed here at the top of this slide. This year, like everyone, we welcome the development of a national health and climate strategy and have been very engaged in the process. We provided a submission to the consultation and participated in the roundtables. Our president, Dr. Jacqueline Small, is a member of the Chief Medical Officer Advisory Group, which is advising on the development. And also during the consultation period, the RACP Climate Change and Health Multi-College Advisory Committee met with Madeline Skellen, the director of the new National Health and Sustainability Climate Unit. And that gave us an opportunity as a group of colleges to speak directly to Madeline. We provided her also with a copy of the research report, Climate Change in Australia's Healthcare System, to highlight the work that we've done as a group about the topic. Regarding health and fossil fuels, we recently wrote to the Northern Territory Chief Minister and the Australian Prime Minister about the health harms of climate change and of fossil fuel use and extraction. And in response to the intergenerational report, we produced a media statement. The report, as you know, has a welcome focus on health, aged care and climate change. The media statement noted the need for prevention, for specialists to be included in multidisciplinary care, and also how important it is that action on climate change is urgent. We continue to align the healthy Climate Future campaign with evolving developments, such as the national strategy. Can I have the next slide, please? This slide lists the existing professional development resources for members on climate change and its impact on health, and they are listed to the left. And on the right, it describes a new e-learning resource which is under development, which will draw on the research report. I'll go on to the next slide. We commend the DEA for developing the Green College Guidelines. The RACP is using the guidelines as a tool to strengthen our approach to environmental sustainability across the college in all its sites. We've either completed or substantially completed most of the recommendations and guidelines and are either progressing or investigating the remaining actions. Our environmental sustainability policy has been approved by the board. Next slide, please. I'd like to highlight the continuing contribution of the RACP Climate Change and Health Multi-College Advisory Committee. We've been working together as a group of medical colleges for several years now. As previously mentioned, in 2021, together we launched Climate Change and Australia's healthcare system, which examined the risks that climate change presents to Australian healthcare systems and how best to manage and respond to these risks. Whilst we started as a group of 9 medical colleges, this has now grown to 13, including the RACP. And together we represent over 100,000 doctors. And this enables us all as a group of colleges to provide clear messaging around consultation processes. And it's an absolute pleasure to work together. It's a wonderful, wonderful group of people. In July, we released a joint statement supporting a strong national health and climate strategy, and this received widespread media, including coverage on ABC TV. The joint statement called for a national strategy that is fully funded and resourced on an ongoing basis, has national cabinet sign-off to enable its effective implementation, is guided by First Nations knowledge and leadership through strong partnerships and co-design, and builds healthy and climate-resilient communities by addressing the wider determinants of health. And just our final slide, please. And I encourage you to visit the website for this to find out more about the Healthy Climate Future campaign. Please sign the multi-college petition, which is supporting a strong national health and climate strategy, fully funded by the federal government. Thank you.
Excellent. Thanks very much, Lynn. Hopefully we can get the link to that one maybe, but otherwise I guess it's on the college website. Is that right? Yes,
I'll pop it into the chat.
Lovely. Excellent. Thank you very much. So next, Associate Professor Karen Fielding, representing the Australasian College of Surgeons. Go for it, Karen.
Thanks very much, John. Next slide, please. I would like to acknowledge traditional custodians of country throughout Australia and recognise their continuing connection to land, waters and culture. I'm on Wiradjuri land near the mighty Murrumbidgee River. Tēnā koutou, tēnā koutou, tēnā tātou katoa. So firstly, RACS recognises its leadership role and has supported the Lancet Commission on Climate Change and Health, calling for the healthcare community to take a positive stance in advocating for emissions reduction and examine its own activities. So we fully support the Lancet Commission. Next slide, please. We were actually the first medical college to sign up to the Green College Guidelines, and we are progressing very well with these guidelines. And out of that has come our establishment of our environmental sustainability and surgical practice working party. Next slide, please. So our successes to date, as I said, the Green College Guidelines. We've been committed to working with the Australian Government and the new Sustainable Healthcare Unit to implement initiatives which reduce the impact that surgical practice in particular has on the environment, understanding that we are one of the biggest makers of waste. and these initiatives reduce the impact of our surgical practice while ensuring patient safety and quality of care is not compromised. So RACS recently met with the director, Madeline Skinner, to discuss the unit and RAC's response to the consultation paper. This was a productive meeting and we have ongoing collaboration secured. We also have had two of our members working with United Kingdom Health Alliance on climate change. Dr. Ken Loy and Dr. Ben Dunn represent RACS on the United Kingdom Health Alliance on Climate Change Green Surgery Oversight Committee. Our representatives include, the representative on that committee include several college groups across England and Scotland, representatives from the USA and Canada. An evidence-based guide to being more environmentally sustainable in surgery has been developed, with the final report due to be released in November. We've recently developed a reusable gowns position statement, an evidence review and position statement that we've led, which was endorsed by our council in May this year. This was shared with ACON. It's been endorsed by ACON. It's now at the Australian New Zealand College of Infection Prevention and Control for endorsement. So we're pretty proud of that. Webinars and podcasts. We've hosted numerous webinars and podcasts on initiatives that support efforts to reduce the impact of surgical practice on the environment. At our ASC this year, 2023, in May in Adelaide, in addition to several presentations on environmental sustainability, we had e-posters summarising Australian and New Zealand surgeons' attitudes to our role in climate change mitigation, and these posters were on display throughout the Congress. RACS ASC in 2024, so our health policy and advocacy group and our environmental sustainability group will continue to prepare for hosting our Christchurch ASC in 2024, which is all about quality and safety in surgical practice, general healthcare and environmental sustainability in surgical practice policies, and advocacy issues will take centre stage. The Planet is the title of our first day plenary, which is dedicated to environmental sustainability. Next slide, please. So we have started to work to make surgery more sustainable. We're prepared for the larger role that colleges will need to take in order to lead in this space and ensure a safe and sustainable system for our patients and for our planet. Thank you.
Thanks very much, Kieran. It's really important to have the surgeons on board. They've often led with many things in the past, like seatbelts and etc. So, you know, it's great to have the surgeons working hard and yeah, hopefully can make plenty of noise as well.
Yes, we'll do that.
Yeah. So the Royal Australian and New Zealand College of Ophthalmologists is next, and that's Michael Loughnan. Over to you, Michael.
Thank you very much, and we can go with the next slide if that's okay. Thanks. So I thought I'd share with you how we're trying to achieve change. I think we've been fairly spectacularly unsuccessful over the last couple of years. We really tried pretty hard to instigate change within our surgical practice, but you keep on running up against a resistance, and sometimes you get the impression for every one step forward, you get pushed one step back. You know, suddenly there's someone's found even a less sustainable way of providing the service by putting some extra condition in. So the next slide, please. So what we've found is we really need to build the evidence. People are very good at finding reasons not to make change. I think it's a natural sort of default for a lot of people. So we've spent a fair bit of time reviewing the evidence, publishing our own papers. We've got quite a few papers from ophthalmology and from the clinic itself now, and have actually put together some sustainable practice guidelines. So you can have the next slide, thanks. I think it's really important to enable people to make change. There's a lot of resistance to change from people, and people are also worried that if they make a change and it's not a standard of care, they could be held responsible. So one of the things the college can do is facilitate that change by identifying it, publishing it, approving it, and then it becomes a standard of care, or certainly an accepted standard of care. So we've done that. We try very hard to make sure that it's evidence-based. A lot of the restrictions about what we do in theatre, a lot of the wastefulness in the theatre has no evidence for it at all. You know, a lot of the single-use stuff, a lot of the plastic that gets thrown out, there's no evidence at all that it provides better care. It certainly makes care more expensive. It makes it more wasteful. It puts more plastic into the system, but there's often no evidence whatsoever that actually provides better care. There's often good evidence that it does not. So the next slide, please. We're really helped with this in ophthalmology. There's a big international group of organisations, not only colleges, but all sorts of groups that have come together to try and create a basis of evidence for a better model, not only of care itself, but how we provide care in the clinic and afterwards with regard to reviews and that. So the next slide, thanks. So this is I sustain. We love the first person pronoun. It's very good to have the word I, so we can pop it in front of sustain. And so it's a global partnership, and this is only a few of the groups. RANS goes on there, but it's fairly American and European based, but it's really a great grouping, and it provides a lot of evidence and a lot of backing for change. So the next slide, thanks. I think having a peak body is really important. You really need a peak body to go in there with the authority, not only to speak to the providers, but for the doctors themselves. We've found that industry often really wants to make change. They're not difficult to engage. They want to make change. They know they have to, but they need us to push it along. So they're actually crying out for our leadership. Regulators like accreditors and ACORN and that, we definitely need to involve them, not as somebody we bat up against, but as stakeholders we work with to provide better outcomes. Almost all of them have an aim for sustainability. We need to facilitate that. The hospitals and day surgeries, not so much. They can be pretty difficult when you get into that. It's actually difficult to change practice. We need to really get a lot of pressure, and that means not as individual doctors, but as a peak body. Next slide, thanks. One of the things that I Sustain does is tries to sign up facilities to a pledge. But the next slide, thanks. When I go to a hotel, I often see this sign, and I dutifully put my towel on the rail, and when I come back after going wherever I'm going, it's been replaced. So it's all very well to have a policy and a sign. It doesn't lead to an outcome. So the next slide, thanks. We really need to have key allies within the systems that can work for us. We need to educate the staff, and it doesn't only mean the doctors, and it doesn't only mean the nurses. One of the key groups is procurement, and I think Professor Kelly mentioned that. We find that working with procurement is really important. And if I had my wish, it would be to have a chief sustainability officer within the hospital, and that person has to feed back to the executive. It's no use having someone who doesn't have power and can't feed back. It's really something that I'd like to have, not only a CSO, and there are CSOs around in big organisations, but they've got to sit within the executive and have some power. So the next slide, thanks.
15 seconds there, Michael.
Thank you. Good timing. So I just wonder if we can't, as a whole group, develop something that we could all sign up for with regard to hospitals. And I told you we like the first person pronoun. So maybe not I sustain, but sustain me as a sustainable medicine. And we could really pressure as a big peak body hospitals. Thank you very much.
Thanks very much. Yeah, so important, that collaboration and working together. And I think it's interesting that you said a lot of people can find reasons not to change, but unfortunately we have to push them along and make these changes happen. It's very important. So Chris Barnden's next for the Royal Australian New Zealand College of Obstetricians and Gynecologists.
Thanks, John.
Chris.
Thank you. I'm talking to you from Muwinina country in Hobart, and also acknowledge the traditional custodians of the land. So RANSCOG, I think there's a lot of goodwill and a lot of concern amongst the O&G community and amongst staff at the college. And you can see that in the way that we've had climate change and environmental themes as major themes in the last 3 ASMs and many other meetings. And you can see it in the way sustainability is embedded into college house operations and the building and design of the new college house a couple of years ago. In terms of, I guess, coordinated advocacy at college level, I do feel like compared to a lot of the other colleges we've heard speak that we're probably just getting going. What we do have, we've got a 2019 position statement on climate change. We've got a 2020 statement on prolonged exposure to bushfire smoke and poor air quality. I didn't put those on the slides because they were a little bit just a few years ago. Last year, we released an information resource for patients and clinicians on air pollution and pregnancy. And we've been active with making submissions, endorsing the multi-college statement, but have been part of that process. But I think the most exciting thing, and what I hope will really propel us more into what a lot of the other colleges are doing, is we're in the process of establishing an environmental sustainability working group. And I hope that will be up and running by the end of this year. And I've been frantically taking notes from what everyone else has been doing to inform what we do. Yeah, that's where we're at. So thank you.
Excellent. Thanks very much. It's I've been very busy in this space for a long time, and yourself and a lot of your colleagues been so busy with the resources. So it's great that the process is driving on. So from the Royal Australian New Zealand College of Psychiatrists, we have Sibel Day, last but not least. So hand over to you, Sibel.
Sure. John. So I'm here to represent the Royal Australian New Zealand Elizabeth, very much to acknowledge that on the Gagosian Nevis. Could I next slide? Talking anyway. Great. Thank you. So about was something that I'm really pleased to say the College of Psychiatrists has been really active in. So just, sorry, coming back to the slide before, that's included having some webinars with a number of other colleges and also other organisations that are active in this space, and they're still available live on the website, or able to be watched whenever you like on the website and free to watch. So both on what's going on in terms of climate change and mental health, and also what we can do. Some of the other things that the college has been involved in is joining the COP Squared, which is a group, an international group that is looking at how to improve resilience of people in the face of climate change, and we'll be having a discussion and a segment in the health component of COP28 this year. Next slide, please. Our Climate and Sustainability Steering Committee started with Dr. Moore as in her, before becoming president, was one of the things that she did as president-elect was to have a Climate and Sustainability Steering Committee. And that group was quite a small group, but was very active. And the recommendations from that group have gone to the board, and we're expecting to have outcomes of that by COP28. Some of the things that were the themes of that included wanting to have a specific climate and sustainability group within the college, and that really reflects that there's a huge level of interest among many fellows in the college, and there's been wonderful work done by the staff. And I'd have to say that I haven't covered many of the things like divestment from fossil fuels and work that the staff have done, because that was already prior to the last presentation. Can I have the next slide, please? So some of the other things have been a big increase in how much there has been in the education and professional development space. So this is from the College Congress. this year, where we had both one of the IPCC lead authors, Catherine Bowen, speaking about climate change and mental health, and you can see a screenshot of that down the bottom, as well as one of the Climate Steering Committee members, Dr. Michelle Atkins, presenting about sustainable private practice in psychiatry, as well as advocacy. And then we had Pat Dudgeon and Alan Rosen and Stuart Sutherland, so talking from and with a perspective about First Nations contribution and understanding and care for country, and how that links in to what we understand and what we need to do about climate change. Next slide, please. And as a number of others have mentioned, the College of Psychiatrists was also actively engaged in the National Health and Climate Strategy, and I'm very pleased to say that our submission is available on the website if anybody's interested in having a look. And it also conveys that there has been a progression in terms of the college's position around making it clear that climate change is a mental health issue as well as a health issue more broadly, and that it has current impacts on mental health of Australians in 2023, as well as, in fact, on people in Aotearoa and New Zealand, although obviously this was the Australian strategy that we were contributing to, and that there is an urgent need to address in a coordinated way the mental health impacts, as well as to prevent further harms due to worsening climate change. Next slide, please. And looking forward, some of the things that I'm certainly hopeful and that are in the themes that we're anticipating will come later in the year will be formal trainee programs around training on climate change and mental health, as well as sustainability. Some of those are starting to happen on a voluntary basis. I know there's going to be one in New South Wales later this year, and there's certainly a volunteer to produce one in WA if anyone's listening. And we're also anticipating that there will be resources on the website around what people can do in terms of making their own practice sustainable and progress on the college's position around advocacy. And we're expecting those outcomes by COP28. And I'm also hopeful that we may possibly have someone representing college at COP28. So really hoping that you'll keep thinking about that, psychiatrists out there who might be listening, and anyone else who would like to come. Thanks very much.
Great. Thanks very much, Sibel. Great to see some involvement at COP28 because, you know, obviously Australia has to do its bit, but we really need the whole world to be brought along, and I think that the health and particularly the mental health sort of side of things is definitely a way in to get everybody in the world acting on this issue. So great work, and thank you. So there you go. 10 colleges presented. Great amount of work being done. We have some time now for some questions before we wrap up at 9. Thanks for putting in your questions already. And thanks, Stephen and Paul in particular for hanging around for the question time. We'll see how we go. I thought I might take the prerogative as the person asking questions to ask the first one. And this sort of bounces off, I guess, one of the questions from Sean Watson. I guess with all this work going on, and this, I guess, is directed more towards you, Paul and Steve, who have more connection at a political kind of level. You know, it's great that the Department of Health is involved, but I do wonder, do you get questions and queries from other departments and other silos, I guess, at a federal level on this issue? And does that mean that there is scope for having pressure on, you know, things like new fossil fuel developments and, you know, knowing that that's such an important issue moving forward?
I might start. Thanks, John. I saw that question in the chat, in the Q&A. I reflect on on the important role that I have is not always obvious externally because of the nature of my work. And I think, and I remember a very wise public health physician was working in Newcastle some years ago, where he was faced with that criticism that he was not sort of open or out there criticising government policy in relation to a range of things. I can't remember exactly what the detail was, but he explained, look, I can do that once, and then you lose me as an internal advocate. And so, you know, for this group, please do not take my silence on that type of issue as being actual non-support or non-engagement behind closed doors, and that's where I can have my most effect. So so for that, in relation to fossil fuel issues in particular, and Beetaloo in particular, which has been quite a lot of questions there in the chat. On the sort of wider kind of climate agenda, yeah, we're very active, and I've got an amazing team that are working under Madeline in that group. Really, you know, a couple of world leaders that have come back from the UK specifically to be part of the National Health Sustainability Unit. We have, you know, constant discussions, at least daily, with right across government, and the point of health being an important aspect of all policies, but all policies also affecting health, we do on a daily basis. So as I said in my talk, this is very much part of a whole of government approach, and what an amazing thing to be part of, and working for a government that actually is taking that seriously. But there's more to do, and I'll leave it at that. Thanks.
Yeah, thanks, Paul. That's good to hear. Yeah, and certainly the change of government seems to have brought a change of attitude as well. What do you think, Steve? How do you see this, the political landscape, I suppose?
Yeah, look, I want to acknowledge everything Paul's doing, and it's very clear that he's very passionate about this and understands the importance. I meet with lots and lots of federal political leaders, and I'm regularly asked, you know, Steve, what do you think are the key health issues for the country? And my answer invariably begins with, well, climate change is the single most important health issue facing Australia and the world in the medium to long term. And I think we have to frame everything else around that. So I make that clear organisationally. I agree with Paul that I think you need to stay in the tent to affect change, but I'm always trying to highlight it, and I think it's starting to sink in with certain leaders.
Yeah, right. Oh, good. Well, I think it's that recurring message, isn't it, that's going to make it sink in. I might, Nicole, do you want to ask a question? So you've got your hand up.
Yeah, it's just more of a comment on that question raised. You know, it's sort of like the iceberg. There's only a small amount that people actually, probably that an iceberg's not a really good analogy these days, because it's sort of, you know, melting, but you only see a really small part in advocacy. You don't see all that happens, you know, underneath the surface, and so many conversations, so much time takes place just to get very small, you know, outcomes or perceived outcomes. One of the things about advocacy, as I said, it's often very quiet. And the most important decisions happen behind the scenes. But it also is about leveraging those conversations. So you think about Middle Arm, for example, and one of the really strong political allies in this has been David Pocock, and he has a really important position in this space. So then thinking about where we sit as GPs and leveraging those decisions, whether it be around funding of general practice or payroll tax or those sorts of things. And it's ensuring that we also support everything with a health lens, and supporting, you know, David Pocock's decision and his advocacy around Middle Arm has been really important for RACGP as well. So we do have really important voices around the table. It's just knowing when to use them, when to be quiet, and when to speak loudly.
Yeah, right. Yeah. Strategy, I guess, and using that correctly. And I suppose on the primary care kind of position, there's a question about how the National Health and Sustainability Climate Unit is going to sort of look at primary care and maybe any office-based practice. Again, Paul, where do you see? I know a lot of the emissions, the big emissions, come from the hospital facilities and things. But where do you see? What do you see happening in the primary care space?
Yes, so that was a question I actually answered it in real time. But I think, look, I think the way that Kate, her three aims in the hospital space, really also talks to general practice and the importance of general practice and primary and primordial prevention, so public health practice as well. Keep people healthy and well and independent, value-based healthcare, and decarbonise the high-value healthcare. And so that applies to general practice as much as it does in the hospital. I think the issue of advocacy has been, really demonstrated tonight by several and the privileged position we're in, particularly frontline clinicians, to talk with their trainees. That's been mentioned, but also patients in the wider community. I think that's an area. And then the other part is is really engaging and involving. This is a really strong element that's come through with our our stakeholder engagement over the last little while in the planning and the preparation and the response and the recovery from climate-related disasters. So involving general practice in that. It's a kind of a blind spot for state health departments because they don't run general practice. So I think that's something that we can do from the Commonwealth to really assist with that, involve and engage with primary health networks, learn from those ones that have done great work, like up in Northern Rivers, and like with all of these national things, make them national. So there's great ideas that have come through from individual clinicians, individual colleges, individual hospitals, individual GP surgeries. Let's make it national.
And I think that pharmaceuticals is something like 20% of our emissions. And I guess a lot of those are the anesthetic gases and maybe the propellants. But is there work going on, with, say, Medicines Australia or such to look at, funding drugs that maybe have lower footprint versus others?
Absolutely, yeah. There'll be a key component of the strategy if I get my way. So let's see, but that's something that when you think about what the national government can actually do, one of the things is we spend a lot of money on procurement of medicines and medical devices, and like many other countries, it's an opportunity. If we really, there might be small gains for every single device or medicine, but when you multiply that by billions of dollars of contracts every year, my view is that it has to be in there. Let's have green.
Absolutely. Lynn, would you like to ask a question?
Thanks very much indeed, John. And just a quick comment to say that it's been terrific to go into the round tables and to be able to put on the table the research report that we released as a group of colleges and our statements, the joint statements we're making as groups of colleges. I mean, the Commonwealth government and people like Paul have a lot of other people who are pressing on them, trying to have their view of these issues take precedence. And I think it's, to some extent, as health professionals, we are very, very polite, generally speaking, about the way we engage. Although I don't know whether that's what it feels like from Paul's end. But I think it's really important when we go that we speak as one voice, because it helps. It helps get our message across. It helps our message to be efficient. And I think it's really important that we're effective in getting our messaging through at the moment, John. Thanks.
Yeah, thanks, Lynn. Sibel, did you have a question?
I have a question sort of linked to a comment, which was just it's wonderful to hear about what's happening from you, Professor Kelly, and to hear about what's going on behind the scenes as well. I'm keen to encourage or to hear if there's any progress in terms of having mental health impacts understood in the way that you clearly do from the way you were speaking with our federal counterparts, because I attended a youth mental health friends event at Parliament House this morning and was surprised to hear a huge number of other contributors to youth mental health mentioned, but in fact nothing said about climate change until, with a different hat, I said something about it. And I just wonder, is there something we can do to support that, or is there more happening and we're just not seeing it?
Sybil, I think it's a fair criticism, and again, it comes back to the sort of advocacy that you and others in your college, but also all of us can really. It's important, firstly, but secondly, it's a great example of the whole wide holistic issue that this is. It's an existential threat to human existence and the existence of the planet. I actually use those words every time I talk about it with my colleagues in the health department. But you need to find the place that they care about. And I think, mental health is such a big thing. Youth health is such a big thing that I think we all should be really pointing to that. Because I mean, I'm sure many of you have children in that age. I mean, my kids are really, really anxious about it. Like I was about nuclear disarmament back in the day. For them, it's that they recognise the existential threat in their lifetime, and we need to take that seriously. So I'm not surprised to hear that it wasn't front of mind, but thank you for raising it in that forum.
Yeah, it's great to see those positive solutions as well, and I think that transport policy or planning there is kind of one of those positive solutions that would be great for mental health and for youth in particular, and for mitigating. And I suppose that leads on maybe to the last question, just about the strategy that will be coming out. Will health in kind of all policies sort of be part of that strategy? Do you think?
So that was a very strong message that came through with the contributions in the sessions as well as the written submissions. So we'll take. I didn't include everything in my talk. There's many other things, including some of the issues that Kate demonstrated with the work that's happening in New South Wales. So that kind of measurement of emissions and measurement of getting targets and making that part of the solution is one. Health and all policies, certainly, that's something put in there. How it will actually fit into the strategies really will be a decision of the minister ultimately, of course. But I find health and all policies easy to say, hard to frame as specific actions, but as an overarching kind of objective, I think it will certainly be there. Whether there's specific actions related to it, that's a little bit less clear to me at the moment. But as I said in my talk, we're meeting with Minister Carney this week. We're continuing to push ahead with the timeline we've been given. We hope that she may well be attending COP28. That's still to be finalised, but that's certainly an option, and wouldn't that be wonderful to launch a strategy at that? But that's something to work through. It puts the pressure on us to get this thing finished. But that's that's certainly something we'll be discussing with the minister later this week.
Yeah, great. Oh well, that would be fantastic. That would be a fantastic announcement and an event. So our time's nearly up. So thanks for all the questions, and thanks very much, Paul and Steve in particular, for your answers. I might hand over to Eugenie and Steve just to the last few minutes just to wrap up. So thanks very much, everyone, for all your attention as well tonight, and all the presenters from all the colleges. It's been terrific. Thanks.
Great. And thank you very much, John, for chairing the bulk of this meeting. And we've got a final slide to put up. And I also would like to extend my thanks as the co-convener of DEA's Sustainable Healthcare work to our speakers tonight. They've been fabulous presentations, and to have such involvement from all our colleges, or 10 of our colleges, and, well over 100 people listening in tonight. So thank you. I think it's pretty obvious from what's been said tonight that working together, collaborating decisively and with courage is what is needed. And many of you have already demonstrated that tonight in what's been done and our intent of what we need to do going forward. Because we do need to act. It is urgent. Humanity needs us to act and lead. And we've heard why doctors are well placed to do this. Business as usual is not an option. Business as usual really means that a child born today will probably be experiencing a world that is 4 degrees warmer, which is not really worth thinking about. Business as usual also means the healthcare sector by 2050 would be predicted to have increased its carbon footprint 3 times. So I really encourage all the colleges and those who have influence in other societies to come on board with DEA and AMA's emission reduction targets for the Australian healthcare sector, net zero by 2040, and importantly, an 80% reduction by 2030. Might seem a bit audacious, but it's really actually what's needed if we're going to follow the evidence and have any chance of meeting our Paris target agreements. And we do pride ourselves on evidence, and it's been touched on tonight. Sustainable healthcare is about practicing evidence-based healthcare. It's about providing the right care at the right time. It's a win-win situation. And as leaders within healthcare, we really have to step up and work collectively. That was mentioned as well. Encourage our peak bodies, our regulators, and now the fantastic formation of a national unit to realise what we need to do. It's also been mentioned several times tonight that DEA and the AMA have developed some Green College guidelines. Several colleges have already endorsed them and mentioned them in their talks. And thank you very much for that. I encourage others to have a look at those and also see how they can use these guidelines to work towards their advocacy goals and also their own organisational environmental impact. So thank you again, and over to you, Steve.
Yeah, thanks very much, Eugenie. Again, we're coming on to 9 o'clock, a great night. There's so much to do, but I can't think of a better group to really take leadership on this, lead the community and lend our voice to all of this. So thanks to all the speakers tonight. The AMA remains absolutely committed to positive climate action, working with DEA and working with all of you. So thanks very much for this evening. We'll let you sign off and our communique will be going out. So thanks to everybody and all the colleges who've signed the communique with us. Thanks for this evening, everybody.